Hello, good afternoon. My name is Nigel Maynard, Editor-in-Chief of Drugstore News, and welcome back to our ongoing series where we interview thought leaders in retail pharmacy. My guest today is Dr. Marc Watkins, the Chief Medical Officer for Kroger Health. Dr. Watkins, how are you?
Nigel, it's great to be back with you. I'm doing well. Thank you for having us.
We're glad to have you here. So Kroger Health is known within retail pharmacy for its efforts around food and medicine, but today we're going to be talking about something that's somewhat related, which is holistic health and how Kroger is guiding patients on their health and wellness journey. So tell us a little bit about how you're approaching holistic health from the viewpoint of encompassing physical, mental, and social health.
Yeah, well, thank you for having us again, Nigel. And it's great to be back. As I mentioned, at Kroger, we've been on a mission for quite some time to really help communities that we serve live healthier lives. And to that end, food as medicine has been an integral portion of what we're trying to do. And it really means a dedicated approach to eating and enjoying food so that one can live healthier lives, but also to improve outcomes and to prevent illness before it starts. So we believe that food is just an integral component to all of that. And so from our solutions around our nutrition scoring system and rating system, where we help to make it easy for folks to figure out what foods are healthier for them, that's part of that journey. And then finally, I think with the commitment of all of our healthcare resources, be it the retail pharmacy or the clinics inside of our grocery store, we have this interprofessional, interdisciplinary team that is dedicated to really serving the customer and our patients one at a time, and trying to really personalize those solutions so that they become really sticky, Nigel, right? So that they align with a patient and a customer's goals and beliefs, and we're there for that journey with them as long as they're with us. And so that's a good place for us to start this conversation, I think.
Well, you've often said that the person's zip code affects their disease states and life expectancy. So what campaigns has Kroger launched to help associates and customers in these underserved areas?
Unfortunately, and there are differences, and the statistics bear out that there's some areas and zip codes that have differences in outcomes. I think we've been very pleased of our ability, especially with underserved communities, to be able to expand fresh food access with our EBT payment and acceptance for SNAP online groceries for orders nationwide. So independent of zip code, thinking about an opportunity to really help customers have access to fresh, affordable, nutritious food is a huge goal. And we've been really proud of the efforts of the teams working very closely with the U.S. Department of Agricultural, Food and Nutrition Service, the USDA, to enable these EBT digital transformations across all of our banners to make food accessible. So thinking about how folks are shopping with us on an online or a virtual environment, it can make it very easy for them to select the foods and the choices and have them available for pickup or delivery where available in their communities. And that's just one way that we're providing access to those communities.
Now, as we know, food has really strong cultural connections for some people. So it's really difficult often to get people to start new habits. So how does Kroger tackle helping patients look at their health holistically and try to convince them that improving their food can improve management of chronic conditions and their outcomes?
We've all heard that adage that you are what you eat, right? Mm-hmm. And so from a very young age, we likely have heard a lot of that, and that's across cultures, right? And that's across not only that, but demographics. And so one of the things that we really want to be able to do is personalize the offerings to appeal individually to our customers and to our patients, really to make it personalized. Eating is very personal. And
Mhm.
so making sure that it's culturally relevant to our communities is incredibly important. Let me give you a good example. When paired with our dietitian services, they allow an opportunity to customize things like meal plans and coaching and formatting in a way that um, uh, makes it very simple to gain cultural acceptance. And so all of our dietitians have training in cultural competency, ensuring that they can connect not only on that emotional level, but also on that personal level. And that really helps to design specific outcomes or specific programs that really meet people where they are. And I think that's an important concept, Nigel, right? Because you just laid
Mhm.
out that um, things that aren't culturally relevant uh, become a barrier
Yeah.
to many people. And so um, we know that healthcare access can be a barrier for some. And so removing any of that friction when it comes to understanding and making sure that very familiar foods are part of a nutritious set of options for people are very, very important. So I think that's one of the ways that I think there's a point of difference in personalizing solutions rather than just simply generalizing them to a one size fits all. We've seen that happen with limited success
Mhm.
and see a greater opportunity to personalize solutions for our patients and customers moving forward.
Now, Kroger has a system called Opta, which is sort of like a food scoring system, right?
Right.
So tell us a little bit about how that works and how it helps patients in their health and wellness.
Yeah, just like I mentioned, the really it's to help people um, make the easy choice the right choice, right? Just like I mentioned that we've been able to have SNAP and EBT payments online to make it more convenient for customers to purchase fresh and healthy foods. They can also explore nutrition facts and healthy options using our UpUp nutrition rating system. It's free. It's available through our Kroger app and Kroger banner. As customers fill their carts, they can see their scores, and then they're able to explore better for you alternatives
Mm.
and shop specifically around specialized diets that are aligned to them. So if someone is interested in understanding what potentially a vegetarian diet may look like, or a diet that's low in sodium or no added sugar, they can add those specific dietary tags within the app, within the OptUp rating system that's personalized to them. That gives them ability to shop for those healthy foods while in the store. So they can simply use a mobile phone and scan the back of a product and get that score right there. And then we can also help them track that score over time with the OptUp scoring system. So that provides them with a kind of a longitudinal record or a past understanding of where their scores have aligned, and then makes it easy for them to continue to make healthy choices. And let me add one more piece to that. As you personalize these items, like for example, low sodium or low sugar or no sugar, um, that becomes part of what happens with your shopping experience moving forward. So you'll see things like a green, so it's color coded that if things that are healthier for you or better for you items, if they're labeled green within the OptUp scoring system, you realize, hey, that's a safe bet. If it's yellow, you proceed with caution. If it's red, you say, hey,
Okay.
this may be something that I should have less of.
Right.
But doesn't mean that we demonize any of the foods that are on there. But we're saying is, hey, if you're going to get something in the red, it may have a higher sodium content. It may, for you, it may also have more sugar. we want you to go slow. And we represent the red, yellow, and green simply as those that have foods that are scoring in the red. We want that to be 10% of your shopping experience or less, 40% to be in the yellow, and greater than 50% to be green. So that color coding system makes it really easy for folks to make as I mentioned, I opened with the healthy choice, the easy choice.
Okay. So the final question has to do with pharmacists and pharmacist role, because you mentioned the dietitians earlier, but how is Kroger utilizing pharmacists to help with health and wellness for your customers?
So, as you know, we believe that pharmacists are some of the most accessible providers here in the United States and worldwide, and especially here in the States. And we also believe that they've earned the right to continue to work in a capacity to meet the customers where they are. And so we believe at Kroger that our pharmacists continue to operate at the top of their license, and that they continue like they have during the pandemic and after, right? So things like being available, right? So being accessible. We believe that they are a part of that care continuum that continues to provide value to the total healthcare system. And I can share a couple of examples. One, the glaring example is all of the efforts of pharmacists throughout the pandemic of putting COVID shots in arms and patients, but the ongoing efforts around vaccination strategies, around adherence strategies, so that we make our patients more compliant and adherent with their medications, and then making sure that they're on the right medications and that patients really understand how impactful the right medications are for them. So they are part of the what I call the inherent value in additional healthcare professionals providing much needed guidance for patients. And quite frankly, when we look at the accessibility, we see Americans usually see their primary care provider around 2.1 to 2.2 times a year. Access to a pharmacist is essentially, and in our stores, for example, they're 7 days a week, and most folks are in our stores 1.6 to 1.7 times a week. So having access to a pharmacist, whether you are walking in or you want to schedule an appointment, they're available to you to discuss more than just the medications you're receiving. They can also help with a variety of things as well, to include things like we mentioned, our food as medicine strategy.
Dr. Watkins, thank you so much for joining us today. We really appreciate it.
Nigel, it's always great talking to you. Thank you for having me again.